The hidden causes of low libido. A look at the mind and body. Have you ever found yourself consistently not in the mood for sex? Or perhaps you avoid situations where intimacy might be on the table. This is a common and often distressing issue, and it's a topic that many people feel alone in experiencing. Dr. Anna Good, a urologist and pelvic surgeon, sheds light on this very real and complex issue: low libido or low sex drive. While a large portion of the audience is male, this video is a crucial resource for female partners and friends, offering a deeper understanding of women's sexual health. The discussion marks the beginning of a new series focusing on both male and female sexual health. Before exploring the causes, it's essential to first understand the medical definition of low libido. What does the term truly encompass? And how does one know if it's a problem requiring attention? Defining low libido. Beyond a simple lack of desire, the medical term for low libido is hypoactive sexual desire disorder, HSDD. This condition is clinically defined by a lack of motivation for intercourse that manifests in several ways. This can include a lack of responsiveness to spontaneous desire, meaning a person lacks the response to sexual thoughts or fantasies. It can also be a lack of motivation from responsive desire, where a person doesn't feel aroused even when receiving erotic cues from a partner. A person with HSDD often lacks the desire to initiate or participate in sex, and may even avoid situations that could lead to sexual activity. In some cases, they may only participate out of fear of damaging their relationship. A key diagnostic factor is that this is a change from a person's previous state, not a lifelong trait, and it must have been ongoing for at least 3 months. The most crucial part of this definition is that the low libido must be causing clinically significant distress, leading to personal or relationship issues. For some, a low sex drive isn't a problem, and that's perfectly fine. This condition is also distinct from mismatched desire, where one partner simply wants sex more or less frequently than the other. This is a separate issue and doesn't necessarily indicate a clinical problem. But just how common is this issue, and what makes it so impactful for those who experience it? The prevalence and impact of low libido when looking at survey studies. A staggering 40% of women report some experience with low libido. However, a much smaller percentage, only 10% to 12%, are truly bothered by it. These are the individuals for whom HSDD becomes a significant problem, often leading to decreased self-confidence, self-worth, and self-esteem. The issue is more common in women with a spouse or a long-term partner, and problems can become more pronounced over time as relationships lengthen and the initial spark of newness fades. Studies have shown that over the course of a long-term relationship, sexual activity and satisfaction with sex tend to decline. It's also important to note that women with low libido often experience other sexual dysfunction issues, such as problems with arousal, orgasm, lubrication, and pain during sex. These conditions can be interconnected sometimes. Addressing one of these other issues can lead to an improvement in libido. To fully understand the causes, one must first understand the fundamental science of how the brain processes sexual arousal. The brain's role, excitation and inhibition when a person is aroused. Certain areas of the brain that form the sexual excitation pathways are stimulated. These pathways rely on chemical messengers, or neurotransmitters, and a major one is dopamine. Conversely, when a person is in a state of sexual inhibition the period after intercourse, or when not in the mood, the sexual inhibition pathways light up. These pathways typically use chemical messengers like serotonin and opioids. This neurological foundation is key to understanding the potential causes of low libido. Conditions or medications that decrease brain dopamine, increase brain serotonin, or increase brain opioids will naturally lead to a decrease in sexual excitation. Conversely, anything that increases dopamine or decreases serotonin can lead to an increase in arousal. Women with HSDD may have a predisposition to having more activity in the inhibitory pathway, or they may develop brain changes that either decrease their excitation or increase their inhibition. This isn't a personal failing, it's a difference in brain chemistry. A study where women with and without HSDD watched erotic videos and had their brains scanned showed very different activation patterns. This visual evidence underscores the reality that HSDD is a physiological condition, not a choice. Risk factors. A multifaceted problem, low libido, is rarely caused by a single factor. It is often the result of a combination of issues. The risk factors for low libido often overlap with other sexual dysfunctions, and addressing them can be a crucial step toward recovery. These factors can be broadly categorized into psychological, medical, and physical issues. Psychological problems can be a major contributor. A significant issue is impaired body image, where a woman feels unattractive or uncomfortable with her body, leading to a decreased desire for intimacy. The stress, fatigue, and hormonal changes associated with pregnancy and childbirth can also severely impact libido. A study of 400 women who had their first baby found that 83% had issues with sex at 3 months postpartum, and 64% still had problems at 6 months. This highlights how incredibly common this experience is and that no one is alone in it. The stress of raising children or the struggles of infertility can also be linked to low libido. Several medications are known to cause or contribute to low libido. A common culprit is selective serotonin reuptake inhibitors series, which are frequently prescribed for depression. Since serotonin is a key neurotransmitter in the brain's inhibition pathways, increasing its activity can dampen sexual desire. Other medications, like some antipsychotics and benzodiazepines for anxiety, can also have a similar effect. The data on oral contraceptives is inconclusive, but a widespread anecdotal connection is observed. Many women report a change in libido after starting hormonal birth control, so it's a conversation worth having with a gynecologist. Finally, several medical and physical conditions are linked to low libido. Diabetes mellitus can cause nerve damage that leads to genital numbness, while neurological conditions like multiple sclerosis, Parkinson's disease, and epilepsy can also be associated with it. Chronic conditions like renal failure requiring dialysis, as well as high blood pressure and the medications used to treat it, such as beta blockers, have been linked to a decreased sex drive. It's also no surprise that chronic pain disorders and a recent cancer diagnosis or treatment can lead to a lack of desire. Physical conditions that make sex painful or uncomfortable are a significant deterrent to libido. Pelvic floor dysfunction, prolapse, and issues like urinary or fecal incontinence can all make intimacy undesirable. For postmenopausal women, the genitourinary syndrome of menopause, which results from a loss of estrogen and causes thin, less elastic vaginal tissues, can make sex painful. Furthermore, gynecological conditions like fibroids or endometriosis can cause pain during deep penetration, also contributing to a low sex drive. I hope this overview has been helpful. Please stay tuned for the next video, where the focus will shift to the treatments available for low libido. As always, remember to take care of yourself because you're worth it.